It is normal to feel down once in a while, but if you are sad most of the time and it affects your daily life, you may have a depression. It's a condition you can treat with medicine, talking to a therapist, or changing your lifestyle. There are many different types of depression. Events in your life cause some, and chemical changes in your brain cause the others. Whatever the cause, your first step is to let your doctor know how you are feeling. She may refer you to a mental health specialist to help figure out the types of depression you have. The diagnosis is important in deciding the right treatment for you. So let's talk about depression. Depression is a common and serious medical illness that negatively affects how you feel, the way you think and how you act. Unfortunately, it is also treatable. Depression causes feelings of sadness and or loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home.
With over 350 million people affected by depression worldwide, it's no doubt an incredibly real and serious issue. But what exactly is going on inside of a depressed person? Is there a biological basis for these intense feelings of sadness? In the past, depression was often described as simply a chemical imbalance in the brain. Specifically, scientists believed that a lack of the neurotransmitter serotonin was to blame, which is often referred to as the feel-good chemical. However, the only real evidence for this was that when some depressed people were prescribed drugs which increased serotonin levels, it helped alleviate their symptoms. But while chemicals most certainly are involved, this view doesn't really capture just how complex depression is. In recent years, scientists began to notice that the brain cell growth and connections may actually play a larger role. When we look at the brain of a depressed person, studies show that the hippocampus tends to be much smaller than average. Other areas of the brain are also physically affected, but this region in particular controls memory and emotion. And the longer a person has been depressed, the smaller the hippocampus becomes. The cells and networks literally deteriorate. It turns out that stress may actually be a main trigger in the decrease of new neurons in this area of the brain. In fact, studies have shown that when this region of the brain is regenerated and new neurons are stimulated, mood improves. Interestingly, many modern drugs, including those which affect serotonin levels, have an indirect effect on the growth of brain cells. This is likely why serotonin-based drugs seem to help some patients, but not for the reasons we once thought. Instead, they promote the release of other chemicals which ultimately stimulate neurogenesis or the growth of new neurons. Knowing this, some scientists now believe focus should be on drugs which directly affect neurogenesis. But while your neurons and chemicals may be the direct influencers, many genetic factors have been discovered as well. One particular study found that a variation in the serotonin transporter gene leaves individuals more vulnerable to depression. Every individual has 2 copies of the gene, one from each parent, and this gene can either be short or long. After tracking 800 young adults over 5 years, the study revealed that 33% of individuals with one short version became depressed after stressful life events, and people with 2 short genes fared even worse. On the other hand, those with 2 long genes were much less likely to become depressed with similar life stress. Many other genes have been identified which increase the likelihood of depression too, and it makes sense when you consider that depression and bipolar disorder both run in families. Studies of identical twins show that if one has bipolar disorder, the other has a 60 to 80% chance of developing it too. So while the true cause or causes of depression have yet to be pinned down precisely, and trust us, there's a huge list of other variables that studies suggest may come into play, it's important to remember that depression is a disease with a biological basis, along with psychological and social implications. It's not simply a weakness that somebody should get over, or even something that we have a say in. And just like heart disease or cancer, shedding light onto the subject is of the utmost importance in order to bring funding and proper research. But is depression only a human phenomenon? We look into the question, do dogs get depressed, in our latest ASAP Thought video and discover the many studies done to understand depression among other species, including your pets at home. You can click the link in the description for that video. You can also check out the book Animal Madness by Laurel Braitman, which touches on the subject. In fact, you can get it for free from our friends at Audible by going to audible.com/ASAP. Audible is the leading provider of audiobooks with over 150,000 downloadable titles across all types of literature. You can download this audiobook or another of your choice for free at audible.com/ASAP. And with a subscription, you get 1 free book a month. Special thanks to Audible for making these videos possible. If you think you're suffering from depression, we've included some resources and more information in the description. And subscribe for more weekly science videos.
Before going to a psychologist, what did you feel?
Super lonely, tapos parang wala kang gana. Parang gusto mo lang, yeah, parang, alam mo yun, hindi ka nag-function everyday. Parang yung daily routine mo, wala. Hindi mo na kaya gawin. Parang super lungkot.
And what was the diagnosis by a psychologist to you?
Depression.
Upon experiencing depression, what did you notice about yourself? How did you feel?
Nung na-notice ko na parang, naglulos na ako ng weight. Kahit pagkain, wala akong gana. Hindi ako makatulog. Tapos, super lungkot lang na umiiyak na ako kahit walang dahilan. Tapos, ayoko lumabas. Ayoko lumabas ng kwarto ko. Ayoko gumalaw. As in, parang gusto ko, nandun lang ako nakahiga. Tapos, wala kang gustong gawin sa buhay mo. Ang bigat ng nararamdaman mo. Pero hindi mo alam kung ano yung dahilan. Parang, helpless ka. Hopeless ka na, helpless ka pa. Tapos parang, ayaw mo na lang, paano natapos na lang yung isang buong araw na, nandun ka lang, wala kang gusto.
How long did you experience depression? How long did you experience depression?
Matagal din, tumagal siya siguro ng, it's from September, I think, hanggang November, basta tumagal siya. Tumagal siya hanggang the next year.
So how did you manage your depression? Did you undergo some kind of treatment? If so, what kind?
Not necessarily, pero kinausap ako may kumausap sa akin psychologist. And then, yon tapos, parang dahil na din siguro may strong foundation ako ng friendship at saka family. Parang doon, at least naiis yung nararamdaman ko. Pero, may times pa rin talaga na dadating ka ulit sa point. Mararamdaman ko.
What tips can you give us as a person who experiences depression?
Wag niyong damdamin lahat. I mean, damhin niyo, pero set limitations. Yung parang kailangan sometimes mag-voice out ka din ang nararamdaman. Don't isolate yung problema, huwag mo i-isolate sa sarili. At saka, have faith lang. Kay God, not just kay God, but yung mga taong pinagkatawalaan mo. And be strong lang para sa sarili. Don't overthink. Sabi nga, overthink can kill you. Overthink can kill you.
What lesson in life did you learn after experiencing depression?
Kailangan ko maging malakas. Hindi para sa ibang tao, hindi para sa sarili. Kasi wala namang ibang tao magdadala sa akin kundi sa sarili. Wala.
Depression symptoms can vary from mild to severe and can include 1. Feeling sad or having a depressed mood. 2. Loss of interest or pleasure in activities once enjoyed. 3. Changes in appetite, weight loss or gain unrelated to dieting. 4. Trouble sleeping or sleeping too much. 5. Loss of energy or increased fatigue. 6. Increase in restless activity or slowed movements and speech. 7. Feeling worthless or guilty. 8. Difficulty thinking, concentrating, or making decisions. And last, thoughts of death or suicide. Symptoms must last at least 2 weeks for a diagnosis of depression. Also, medical conditions such as thyroid, a brain tumor, or vitamin deficiency can mimic symptoms of depression, so it is important to rule out general medical causes. Depression affects an estimated 1 in 15 adults, equivalent to 6.7% in any given year, and 1 in 6 people, 16.6%, will experience depression at some time in their life. Depression can strike at any time, but on average, first appears during the late teens to mid-20s. Women are more likely than men to experience depression. Some studies show that one-third of women will experience a major depressive episode in their life. Depression is different from sadness or grief. The death of a loved one, loss of a job, or the ending of a relationship are difficult experiences for a person to endure it. The grieving process is natural and unique to each individual and shares some of the same features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. They are also different in important ways. In grieving, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, mood and or interest such as pleasure are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. For some people, the death of a loved one can bring on major depression. Losing a job or being a victim of a physical assault or a major disaster can lead to depression for some people. When grief and depression coexist, the grief is more severe and lasts longer than grief without depression. Despite some overlap between grief and depression, they are different. Distinguishing between them can help people get the help, support, or treatment they need. Risk factors. Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a role in depression. Number 1, biochemistry. In biochemistry, the difference in certain chemicals in the brain may contribute to symptoms of depression. Genetics. In genetics, depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. The third, personality. In personality, people with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic, appear to be more likely to experience depression. And last, environmental factors. With environmental factors, continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. So, the important question is, how is depression treated? Depression is among the most treatable of mental disorders. Between 80% and 90% of people with depression eventually respond well to treatment. Almost all patients gain some relief from their symptoms.
Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview and possibly a physical examination. In some cases, a blood test might be done to make sure that the depression is not due to a medical condition like thyroid problem. The evaluation is to identify specific problems or symptoms, medical and family history, cultural factors, and environmental factors to arrive at a diagnosis and plan a course of action. For the medication, the brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressant might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers, or tranquilizers. They are not habit forming. Generally, antidepressants medication have no stimulating effect on people nor experiencing depression. Antidepressants may produce some improvement within the first or 2 weeks of use. Full benefits may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressant. It is important to let your doctor know if a medication does not work or if you experience side effects. Here are some tips to better cope up with depression. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feelings and improve mood. Getting enough sleep on a regular basis, eating a healthy diet, and avoiding alcohol can also help reduce symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of people with depression will overcome it. If you are experiencing symptoms of depression, a first step is to see your family, physician, or psychiatrist. Talk about your concerns and request a thorough evaluation. This is a start to addressing other than the said possible treatment for depression. Self-managing depression is also possible. There are also a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feeling and improves mood. Getting enough sleep on a regular basis, eating a healthy diet, and avoiding alcohol can also help reduce symptoms of depression. Depression is a real illness and help is available. With proper diagnosis and treatment, the vast majority of people with depression will overcome it. If you are experiencing symptoms of depression, a first step to see your family, physician, or psychiatrist. Talk about your concerns and request a thorough evaluation. This is a start to addressing mental health needs. Another type of depression, which is a more prominent one, is the clinical depression, in which it is often said to be the cause by a chemical imbalance in the brain, and this is what the result of drug treatments which are based on. Certainly, in many cases, there is a reduction in the amount of certain neurotransmitters found like monoamines such as serotonin and norepinephrine in depressed people. Okay, that's about it for the mental illness called depression. I hope you guys learned and understand a lot from the interview we conducted and to the discussion of depression, which started from what the symptoms are, treatments, medication, how to manage depression, types of depression, and so on up to the cause of depression. Thank you for watching.